Hi, my name is Natika Griffith. This is my presentation on trauma explanation summary. My client today for this presentation will be called Shonda, and Shonda is a 40-year-old cisgendered African American woman who has an extensive sexual trauma abuse history, starting from the age of 9 to 33. She has had six different assailants. Three of them were family members. One was a clergy member, and two were neighborhood acquaintances. Three of those she did tell her parents. Two that happened at the age of 18, and then the last being at age 33, she did share that with her parents, and they told her that they would take care of it. The first two, I'm sorry, at age 18, they told her they would take care of it, but she doesn't know, or she's not aware of what they did to take care of the situation, but she never received any kind of therapeutic help. At the age of 33, which was the last instance that she had, the last sexual abuse encounter, was with a member of the clergy. She did also share that with her parents, as well as telling the pastor's wife, and then realizing after some time before the age of 34 that she may or may not be okay, and she wanted to seek out help. So although she's now 40, about 6.5 years later, she's now seeking out assistance. So Shonda is dealing with some anxiety. She sometimes has difficulty sleeping. She, however, is very optimistic. She enjoys doing charity work and helping others. She tries to stay in positive environments. But again, because of some of what she deals with, some of those behaviors are have impacted how she actually responds to different people and different situations at work, home, and in her neighborhood and community. Now, prior to talking with Shonda, um, I wanted to be able to, I'm sorry, prior to being able to get into any therapeutic work with Shonda, I did want to be able to go over with her and explain what it is that trauma means to me, and how I perceive trauma, which should give her a sense of how I would be able to help her and the direction that we would be able to go. However, at the same time, I would also be allowing her that control, because she is the expert in her own traumatic situations. So it would be geared to what she's going through, the age of when it all happened, and how she perceives her own trauma. Now, before going into how I would approach that with Shonda, I do want to share a little bit of information of what I've learned over the course of this class, through our required course readings. So with Perry's reading, The Boy Who Was Raised as a Dog, that was one of my favorites, because it actually gave me a sense of almost standing back watching him address situations with his children who were his clients. And I was able to kind of put myself into places, or either put individuals that I knew into places to help me to better conceptualize what it was he was relaying in his messages of what he thought. So with Perry, I thought it was very informational and helpful, with him discussing the effects of trauma on the brain and the developing brain, and also the importance of getting history. Sometimes we aren't able to get a history, but whenever we can, it's always something that should be highly considered, because it can give us more insight on how we need to treat. It will also give us insight on when the trauma may have begun, and because trauma is not chronological and it is fragmented based on Vanderkloft's readings, that um, we'll be able to kind of piece those things together and deal with the trauma appropriately and effectively. So, thinking of Rothschild discussed the connection between the mind and the body, which I also found to be very informational. The greatest thing that I took away from there, and that was most I'm at a loss for words, but which was very interesting for me, that really stood out, was the whole idea of the flight, or freeze response, and how that works, where the brain actually perceives the threat and then determines if there's enough space and time to flee, if there is enough strength to fight, and if there's neither, or not enough to do either one of those, then the body will freeze. So I thought that was very interesting, and it helps me to have a better gauge on the responses that individuals may have during the experiences that have become traumatic barriers for them. Also, um, Rothschild points out how triggers work and that they're a part of classical conditioning. So something that is a reminder of a traumatic experience versus actually recalling the experience or playing it over again is kind of how triggers are manifested and they come about, but also that um, through operant conditioning develops the adapted types of stress response. So those things are going to be very influential in helping my clients. So now I'm going to move forward with discussing with Shonda how I perceive and intend to treat trauma. Hi, Shonda. My name is Natika Griffith. I am the social worker that you spoke to over the phone. We did the intake interview together. I'm very happy that you decided to come in so that we could talk. Before we go into any kind of therapy session, I wanted to take the time, this first section, to kind of give you an idea of how I perceive the concept of trauma, so that we could be on the same page and you'll understand where I would be coming from as we work through the traumatic experiences that you've had and how those experiences may have impacted your life and continue to do so, so that you can move forward, okay? All right, so when I think of trauma, I I get a greater understanding from how the CDC recognizes trauma, which is basically a event that causes a lot of stress. But it's more than just the normal daily stresses, not having enough time in the day to do what we need to, or being frustrated at work or with the children or family members, but it's the type of stress that is can be very overwhelming, that makes us feel fearful or hopeless, like we're not in control, or that it causes some serious threat of injury, or the thought that there may be some serious injury involved, and it kind of manifests through certain symptoms that we might experience. So in your case, we would be talking about sexual abuse trauma that you have dealt with in the past. And one of the things about sexual abuse trauma is knowing that there are many individuals that experience this who don't open up, don't share this information, and they deal with it on their own. And it becomes extremely overwhelming, and they try to continue through their day to day with some of the symptoms that comes from the trauma they experience. So knowing that, and then it's 90% of women who are victims of sexual assault. We want to look at it from that perspective, knowing that you're not alone, and that this is something that have been experienced by others, but also looking at it individually, um, and recognizing what you're dealing with, and that those feelings are validated and they're worthy to be addressed individually and not kind of grouped together with other individuals. So, some of the symptoms that you generally or will generally see with individuals that have gone through some type of traumatic event, and it could be various types of trauma, um, would be maybe depression, eating or sleeping disorders, anxiety, um, not being able to concentrate, sometimes self-harm. Now, not to say that these are all the things that you should be feeling, because again, you are an individual, and depending on when your trauma happened, depending on how you perceived it, how others around you perceived it, the type of support that you had. One of the authors that I kind of gravitate to, Clock, talks about how during the time that we perceive have trauma or traumatic experiences will also dictate how we are reactive to them and how it may impact us. So with the experience that you'll have, we'll look at it from how the brain works. So if you've heard of the fight, flight, and freeze response, we'll look at when you experienced this trauma, how you reacted, what was going on in the brain that caused your body to um, react a certain way. And those things are basically for our survival. So even if we're not thinking of it, because a lot of times when we're going through those moments, we're not thinking rationally. We're just thinking about how to survive. So this part, which is a part of our brain that helps us to cope in certain situations that are harmful to us, is what we'll kind of look at and explore as we're dealing with the symptoms that you have and the experiences that you have, so that you can feel more productive, feel more in control, and be able to deal with those things that you are feeling. Also, your trauma could very well have changed how you perceive certain emotions. So prior to all of this, at the age of 8 or before you turn 9 and experience that first traumatic experience, and something that may have made you sad may be perceived differently now because of that. So we'll also take that into consideration as we go through, because we want to be able to work in certain ways to help you to um, try to retrain how you feel and think about how you feel, and kind of think of how you would like to feel with the type of intervention that we'll use to address your trauma. So then lastly, what's going to be important is understanding what it is you're feeling, which is called body awareness. So we want to take a look at those things that are triggering you when you're just moving about day to day, when you're in certain places, and even when you're just by yourself in a moment and you have these certain feelings or emotions that begin to rise up in you. Having an awareness of what's happening, what's going on, being able to regulate those emotions and those feelings and those sensations is going to be very, very beneficial in dealing with them when you're going day to day and they come up, so that you can take control of it. So everything that we're going to do is basically going to be driven by you, because we want to look at it from the perspective of you being the expert. So I'll be here to help you as we go through those things and explore everything that we just talked about, how the trauma manifests, and how we can deal with them so that you can move forward and live the life that you want to live. So that's what we'll do in our next appointment. So I hope that that's okay with you, and anything that we need to adjust, we will. Okay. So I will see you at our next appointment, and I look forward to working with you. And again, because this is highly unreported. I really commend you for moving forward and taking charge. Have a great day.